Good morning or evening or afternoon, depending where in the world you are, and welcome to this first of IWF's of digital offerings to advance women's leadership. We are going to be doing these sessions on a weekly basis to highlight the global leadership of women in technology and policy and culture and other areas. So we hope you'll join us going forward. I'm Jean Meserve. I've been working with IWF for 6 years to help deliver and shape the programming at IWF's international conferences. Let me introduce you to someone who you really want to hear from this morning, and that is Congresswoman Donna Shalala. She is a Democratic member of Congress from the state of Florida. She is a former Secretary of Health and Human Services here in the United States. She is a former head of the Clinton Foundation. She's a past president of the University of Miami, and past chancellor of the University of Wisconsin. She also is a founding member of Women's Forums in not one, but 3 locations: New York, Wisconsin, and Florida. Congresswoman Shalala, great to have you with us this morning. Thanks for joining.
Thank you very much, Jeannie.
I want to ask you first an American-centric question, just because it's fresh news. We just learned that another 6.6 million Americans filed for unemployment benefits last week. That brings the total to more than 15 million, I think. First, your reaction and your projections. Is this going to get worse?
Yes, it is. In fact, our unemployment insurance system, which is run by our states, was not ready for millions of people to be applying for unemployment insurance. So what you're seeing is just the beginning of people that got through to make applications. We're doing something similar to what the Europeans are doing, and that is we're trying to make those that were employed whole by putting enough money in our unemployment system, as well as our small business organization, so that we can take care of employee salaries and keep people at least economically close to being whole as we possibly can. So we expect millions more to be applying for unemployment. In my district, I represent Miami, the beaches, the hotels on the beaches. I represent the port, the large cruise lines, the airport, American Airlines in particular, and of course all the restaurants that are involved in the hospitality business here in Miami. So we have literally hundreds of thousands of people out of work, and our state system is overwhelmed. So it's not surprising, but we're having trouble getting the money to people. So our hope is that we'll get the system more streamlined in the next couple of weeks. We're also sending checks directly out to people that have incomes under $75,000, or a couple that has an income under $150,000. They're going to get $1,200 checks and $500 for each child that they have, and that will go out this week and next week. That will get cash into the hands of people to pay their rent and to buy food.
Congress is talking about pumping even more money out to those who need it, be they businesses or individuals. But a little bit of tension within the Congress on what shape that's going to take. Is Congress going to be able to overcome its political differences to get that aid out?
Actually, it's not very political. It's very substantive. The Democrats want to make sure that we take care of getting money to state and local governments and to hospitals in particular, in addition to giving money to the small businesses, because we're going to run out of the money that we've already allocated to small businesses. And we obviously favor small businesses, but we believe that our state and local governments, as well as our healthcare system, particularly to cover those that don't have insurance, because we don't have universal insurance like many of the countries that our members come from, our IWF members come from. We've got to find a way to cover the treatment. We've covered the test, the treatment for those that don't have insurance or frankly have lousy insurance.
We're seeing some positive data points when it comes to the disease, although the number of deaths is still rising here in the United States. There appears to be some leveling off of hospital admissions, people put into the ICUs. In other parts of the world as well, we're seeing some positive data. Do you think we are, in fact, succeeding now at flattening that curve we've heard so much about?
Well, I think we're squeezing it. I wouldn't say we absolutely flattened it. In fact, I'd be very reluctant to say that. Apparently, human behavior has changed. People are staying inside their homes. That makes a big difference. What we're trying to do is starve the virus. So while there looks like there's a glimmer of hope, I don't see a light at the end of the tunnel yet. And I think people should be wary about changing their behavior, either going outside their homes or not washing their hands or not wearing masks. We've got to be very careful. This is the period in which we've got to have all the discipline all across the world to try to really, really flatten the curve. But more importantly, we want to lower it. It doesn't do us much good to just flatten it, but we've got to get down to 1%. At some point, because we're not going to have a vaccine for at least a year or so. We may have a treatment in the next month or so, and that will help us at least slow down the number of deaths, and that's really important. I think there's more light on the chances of getting a treatment, but our behavior will make all the difference.
You have expressed concern about the trajectory of this disease and the impact of this disease in Latin America. What exactly is your concern, and what are you seeing there?
Well, Latin America has, for the most part, weak healthcare systems. Even though they have a primary healthcare system, their ability to manage this disease and the fact that people live close together in the barriadas of Peru and the favelas of Brazil, that makes them more likely to get this disease. And with a weak healthcare system, and there's turmoil in Latin America. Venezuela's healthcare system has totally collapsed. Colombia is under great pressure because of the number of Venezuelan refugees that have flowed across the border. And they don't have the same kind of resources that we have in Russia or in China or in the United States or in Europe. So I'm very concerned not only about Latin America, but about Africa as well, wherever we don't have weak systems and wherever we have very tight urbanization. That's where the concern ought to be.
And part of the concern is, I presume, that if the disease isn't controlled there, not only will it wreak havoc societally and economically, but also we run the risk of having a boomerang right back into the developed world, correct?
Well, we have a global economy, and this disease doesn't know which border it's on or what political party it belongs to. It continues to come in by plane, by ship, and to everyone. And so we need to really contain it all over the world. We need to get a treatment and to make that treatment available to everyone, no matter where they live on this earth. So we've got some big challenges ahead. Now, I should point out that a lot more people die from the flu, and we do have a vaccine for the flu, and we do have treatment for the flu, but that's because people's behavior isn't what it should be. People should be getting their flu shots wherever they are, and we should be making them available. But it's not as aggressive or transmittable or as deadly the way this disease is spreading, this virus is spreading around the world. But I have hope for treatment, but everybody's got to keep the social distancing, stay in their homes, and wash their hands, and frankly wear masks. I have mine right here if they have to go out.
You mentioned the accessibility of treatments and vaccines. This is potentially a huge problem, I would think, that the countries who are producing these things may keep them for their own populations, and also that the rich countries are going to be able to purchase them where poorer countries might not. I know this has been discussed in pandemic exercises in the run-up to these tragic events of the last few months. Do you think we've come up with a solution for those kinds of problems to make sure there is some sort of global equity when it comes to access?
Well, we've always had a strategy for that. We did for Ebola, where we sent resources to Africa in particular. But let me make this point. We are not safe here in the United States unless the people of Venezuela or of South Africa are safe. And so we're part of a global world. So the need to make sure that the resources get to every part of this earth is in our personal and economic interests. So I'm a big supporter of the World Health Organization. I know our president had nasty things to say about it, but I'm a supporter of the regional organizations. They just don't have the resources to distribute. And it's going to take all of us to make sure that the resources are fairly distributed, even though we have shortages here in the United States. And one of the reasons we have shortages is because we've made our healthcare system very efficient. And it doesn't overbuy. The only way it can be successful is to be very efficient and not to have a lot of redundant ventilators or equipment. And so that has worked to our detriment in the middle of this pandemic. But I think it's very important that we remain as internationalists and we understand that the health of the world is important to each one of us, no matter where we live on this earth.
I'd love to delve into this WHO question a little bit deeper. President Trump is threatening to defund them. What would the impact of that be if the U.S. did that?
Well, it would be terrible. And frankly, he's not going to be able to defund them because we control the House of Representatives, and our appropriators, the people that appropriate the money, the Democrats, will insist on money for the World Health Organization. We've been supporting them for a very long period of time. We have CDC people embedded in that organization. I worked with them for 8 years. They're not perfect. They don't have the resources that they need. They're more bureaucratic than we would like, but we have no substitute for the WHO. The regional people here are called PAHO, the Pan American Health Organization, but they're the arm of the WHO in this region. So there is not a substitute. UNICEF isn't able to take on the responsibilities of the WHO. The president's concern is about China and the WHO's relationship with China and the fact that the Chinese hid some information. But the truth is, we had CDC people embedded in China. We knew about the spread of the virus in December. That information was transmitted to our leadership and they ignored it. So as much as I have problems, as most Americans do, with the Chinese, and the president is blaming them now for this virus, the fact is it's here. We have to deal with it, and it is not the time to weaken an international health organization.
The complaint isn't only with the Chinese, it's also with the WHO for being too pro-China and being too slow in declaring this a global emergency. And I should note, President Trump is not the only world leader to raise this as a concern. Do you think it's valid?
I don't. We knew about the virus. WHO was reporting on it. No, they didn't declare a pandemic until they saw the patterns that were going on. I really don't. I think they're looking for a scapegoat for their own weakness as leaders in moving quickly. So I'm not putting up with that nonsense. We need to move forward and take care of people all over the world. And it does us no good to try to weaken the one international health organization that we have. There's no way the U.S. can substitute that, or China, or Russia, or the Europeans. And so I continue to be supportive. Has their leadership been perfect? Has the organization been perfect? Absolutely not. but that doesn't mean that we don't need them, and we need them now.
To date, the Security Council has been quiet. Does that bother you in the least?
No, not particularly. I mean, they're conflicted all over the place. What is it that we want them to do? The WHO has already issued a call for international investment. Most of the countries on the Security Council will respond to that call for international investment. But it does point out that health is a security issue. It's a national security issue. It's an international security issue. We learned that during the AIDS crisis as AIDS decimated armies all over the world. And it is a relatively recent phenomena in the last 30 years to recognize that health is a security issue, and it requires the whole world to respond.
So you mentioned AIDS, and we've suffered through AIDS and SARS and MERS. Why weren't we better prepared globally for this pandemic?
Well, because it's not attractive. I remember testifying before Congress on the public health infrastructure in the United States, which we really needed to keep investing in. And by that, I mean our local health departments, our state health departments, plus the CDC, and people's eyes glazed over. If I mentioned cancer, they would get excited. So that while we had some readiness and while we had a playbook, while we knew that we were going to get virus after virus, we weren't ready because we had not made the investments. We've been disinvesting in our health infrastructure for a very long time in the United States. And it hasn't just been Republicans, it's been Democrats too. But now we better have a readiness strategy because it's COVID-19 today, but I don't know 3 years from now what the number is going to be.
I'm wondering, you were 8 years, I believe, as Health and Human Services Secretary, then head of the Clinton Foundation, which also was involved in global health issues. Do you have regrets? Are there things that you wish you'd been able to push forward that you weren't able to?
Yeah, and I made it very clear that, and I went around to all the appropriations committees, that I thought that preparation was absolutely critical, not only to viruses, but to bioterrorism in particular. And that the U.S., while we established the stockpile during those years and put in place health experts at the National Security Council, it was easy for this administration to ignore that, to get rid of all the people that were experts on global health in the National Security Council, to cut the budgets of the CDC and the FDA, and not invest in the public health infrastructure. That means that we need a consensus, not only in this country, but in the world, that these issues are directly related to security, to the economies of the world, to our ability to save lives. And that means that we have to collectively come together. It's been very interesting that while the president here has been partisan, the Democrats and Republicans have actually joined together. While they're fussing a little bit now over the size of the package, the first 2-3 packages we were able to agree on, and we've spent more than $2 trillion on trying to both save lives, get more testing, get more equipment, as well as helping the economy significantly. So I think in our country, we've done a pretty good job of bringing politicians together, but we need to bring the world together. We can't
you know better than I have ever.
Versus another. Listen, that disease starts in China today, and it may start in New York or Vancouver or Cape Town tomorrow. So we just don't know enough about transmittal or where these diseases are started. And this one in particular, we don't know enough about transmission and we don't have a treatment.
Attention spans are short, resources are finite. Do you think that this will shake the world awake when it comes to preparedness, that finally the world will take those steps that they have pushed off previously?
I think so. I don't happen to think, maybe it's because I'm an American, that resources are finite. If we're going to save lives, if we're going to save our economy, we're going to have to make the investments in a readiness system, not only for us, and that means a surveillance system, an early warning system, and not just for us, but for the whole world. That's the WHO's responsibility, to identify early outbreaks and to get the resources there to contain those early outbreaks. And then to make sure that they understand the transmission so that the disease doesn't spread around the world. This virus was particularly aggressive and almost impossible to stop. But early warning systems in individual countries would make a difference. And you can see that around the world. The Koreans have been very effective at containment, where in the United States, because we started late, it's taken us a little bit more time, but we're just starting to get our arms around it.
A reminder to our audience that we'd love your questions too. I see some of them are piling up and we'll get to them in just a moment. Remember, it's that Ask a Question tab at the bottom of your screen that you can use to write yours in. Before we get to those, I have one additional question for you, which is about the U.S. global role. What should our role be, the U.S. role, in addressing this pandemic? And are we being outflanked by China and Russia, who seem to be doing a lot more when it comes to international assistance?
Obviously the United States can provide resources, but the truth is we have the best scientists in the world. We have the experts on infectious diseases, and we've trained a very high percentage of the infectious disease professionals that are in governments around the world. We have to continue that role through the CDC. When you get an outbreak, the head of the Centers for Disease Control can get on the phone and call the experts in China because they were trained here and he knows them. And that's true with almost every country on earth. So the scientific expertise is important for us to maintain. But then we have to devote the resources. We have to continue to be a major player in terms of finances around the world. China and Russia can elbow their way in with resources, but they don't have anywhere near the kind of expertise we have to help contain the disease, to give advice to people all over the world. So we will continue to have that role, and we'll build it up over time. We have an election coming up. But I think there's consensus in this country that we can't run away from the world.
You don't think that faith in the CDC has been shaken by the failure to roll out testing effectively here in the United States?
I do think that.
And they've been largely silenced. They haven't really been part of the debate here.
Well, the CDC is not at the press conferences, thank heavens. I hope they're back.
Why do you say that?
Working. Well, because those press conferences are political press conferences, and they don't require Ann Schutte from the CDC, who's the great infectious disease expert. I want her back at the CDC. In fact, I would hope that that some of the other experts, Deborah Birx clearly has a role, but Tony Fauci needs to organize and to supervise the research that's going on around the world to find not just a vaccine, but more importantly, a shorter term treatment. And I worry about him having to spend so much time at the White House as opposed to back in his office, in his laboratory, talking to people around the world. I know he doesn't get any sleep, but I think it's important for Tony to do what he does best. And some of it is articulating standards for us, but a lot of it is really his role in the international search for both a vaccine as well as treatment.
I want to get to some of the great questions from IWF members. The first one comes in from Gail Jackson. She asks, are you concerned that momentum to return to normal and get the economy back running will lead to premature ending of lockdowns and social isolation? If so, can we not mobilize more local, regional, state public health officials and health system executives across the country to educate and instruct about the dangers of this? Testing is not nearly widespread enough to do this safely. Your views?
Yes, absolutely. I'm worried about that. I'm worried about that because the president is so anxious to get the economy started again. But he's getting resistance within his own party and within the government itself, both in the White House and certainly from the scientists. It's a huge mistake to go back too soon. And we saw that in Hong Kong, where they got their arms around the disease and then they went back too soon and it was a disaster. So we're going to have to be patient, as crazy as it sounds. We're going to have to be patient until we have really starved this virus. And I think until we have a treatment and a better surveillance system set up. And whether that's going to take a month or 2 months, I can't tell you. But I can say that we've got to listen to the scientists. These scientists, physicians know what they're doing, and they will be uber careful.
Another question, this one from Susan Grant. Where is the leadership that's going to ensure that the plan going forward surrounding the virus and containing it, as Dr. Fauci says, is in fact executed, i.e. broad and quick testing, contact testing, isolating those exposed?
Well, I think we're getting some leadership in our country from the governors and from the mayors. I see stronger leadership from them, but it's fragmented. And that's why we need strong leadership from the center. And we need the president not to delegate this to the states, but we need stronger and stronger leadership from the center. And we just have to keep demanding it. And we have to be consistent that we listen to the scientists and we take their advice. And their advice right now is to stay home, practice social distancing, wash your hands, and if you have to go out, put a mask on.
Carol Hillman asks, is it too late to get a federal response to this epidemic? How do we achieve that given the lack of leadership in DC?
You know, it's never too late. It's never too late. And we're moving closer to it in the distribution of supplies. Finally, the Army the military has been they know about how to distribute supplies and about the relationship with the private sector. So we're getting more of that, but not the strong voice from the president. He told everybody that the CDC recommended that you wear a mask when you go out, but he said he's not going to wear one. That's not leadership. So look, we have what we have. We have a weak leader, strong science, and a collective people across the world that are going to pay attention to the science. And one way of paying attention to the science is not paying attention to the rumors or the crazy information on the internet. That's very destructive and will kill people in the end. So we just have to pay attention to the immunologists, to the experts, and let them signal us when they think it's safe for us. And it's going to take a lot more testing before we get that smoke signal.
Science has been disbelieved by many. It hasn't been trusted by many around the globe. Do you think that the experience of going through COVID-19 may change attitudes towards science?
I actually think AIDS changed attitudes towards science. That in the end, we found a way to contain the outbreak of AIDS. We haven't eliminated it, and there still are pockets, including in my own city, in the Hispanic community. But the undermining of science is a life or death situation as far as I'm concerned. And we have to do everything we can to make sure the next generation is as committed as many of of us are to following the science. We have no alternative if we want to save lives than following the science.
Rebecca Lyman writes in, what about the testing? How close are we to allowing everyone to get tested with an antibody test? Isn't this the only way we'll know it's time to allow us out from our homes?
The answer is yes, we're not very close. We're doing some sampling in some cities. We're out in clinical trials, but we're not very close. And right now, what we've got to do is have enough tests to test those people who have symptoms or are in groups where we need to test them, like healthcare workers, where they need to be tested on a regular basis so we can protect everybody else. But as you know, this disease can be transferred by asymptomatic people, which means you don't know you have the disease, but you can still transmit it. And so I think it's important. And as the Speaker of the House of Representatives here in this country says, testing, testing, testing. So we've got a long way to go in getting enough tests of the kind that makes the diagnosis before we get the antibodies test.
Isn't it also true that at this point, we don't actually know what kind of immunity we'll have, even if we do have antibodies?
We don't. And there's a lot of information we don't have about this disease. What we do know is if you stay in your house, if you wash your hands, if you practice social distancing, that you can protect yourself and your family, and we can reduce the incidence, and flatten the curve or drive it down, whatever you want to call it. And so we've got to keep doing that. We've got to keep doing what we know makes a difference, and it's human behavior right now that makes a difference, not some test.
Elizabeth Robinson asks, like other pandemics, the current COVID pandemic has gendered impacts on countries globally. Could you please comment on how far governments have incorporated a gender analysis in designing public policy and health solutions? And might I add to that also race and ethnicity analysis?
Yeah. Well, we know countries that have weak health care systems are going to be more at risk. We also know that more men than women are dying from this disease, and we don't know particularly why. We know more men than women are getting infected with this disease. We know that that older people and people with underlying conditions, high blood pressure, diabetes, obesity, are more vulnerable than others. So we do have some evidence. We also have ethnic evidence in the United States, at least, in which African Americans who have these underlying conditions are more vulnerable and are dying at higher rates. It also is because the healthcare system is weaker for them than it is for other ethnic groups. So yes, we're collecting the data by ethnicity and by age, and a lot of that is going on around the world. We know a lot. The average age, by the way, internationally is in the 40s. But if you go to Italy, the Italians can tell you that's not true necessarily where they are, because they're an older society with an almost zero birth rate, except for new immigrants that are coming in. So you can see the impact on places that have an older population. That's our concern in South Florida. Palm Beach, Miami-Dade County, we have a high percentage of seniors, and certainly we have higher numbers, I think in part because of that.
You mentioned the inequities that this pandemic is bringing to light in terms of access to healthcare and quality of healthcare in the United States. Do you think that that's going to give some momentum to healthcare reform in the United States?
Yes, I do. I do think that depending on what happens in the presidential election, that we're going to hear a lot about universal health care. not necessarily a single payer system the way the rest of the world, or at least Europe, has, but certainly an attempt to fill in the gaps where people don't have health insurance. That will be a major platform of the Democratic Party. We will do something temporarily, but it will be a major platform of the Democratic Party in the presidential election.
Margot Provost asked, the unprecedented government closure of businesses with no notice is akin to a taking. Are there considerations for the government to back insurers so that businesses can receive their business interruption insurance proceeds?
This is a complicated question. It doesn't probably apply to the rest of the world. After the big floods and the hurricanes, insurers started to offer insurance, a business interruption insurance, when government made the decision to close down. That was particularly the impact on New Orleans. Many people did not take that up, so they don't have that in their insurance policies, and the courts have not been very sympathetic. Now, after 2008, we did do a little bit of bailout. I don't think we're going to do it again. I do think we're going to help companies with their payroll, particularly companies that have employees, less than 500 employees, or maybe a little more depending on the nonprofits. But I don't see any likelihood of bailing out the insurance companies. And unless you bought that particular took that particular insurance, I'm afraid you're out of luck. That doesn't mean that we're not going to provide bailouts or loans, low interest loans for large corporations and businesses through the Treasury and through the banking system. We're going to drive down the cost of loans to help people in the transition that run these larger companies.
Shannon Gifford asked, the end game for this epidemic, ideally in 12 to 18 months, appears to be the availability of an effective vaccine. We haven't had a mass vaccination event in this country since the 1960s, when the campaign to end polio enjoyed broad support. Both the healthcare system and attitudes towards vaccination have changed since then. How do you visualize a mass vaccination program working in the U.S. at this point?
Despite the fact that there are always pockets of people that don't want to vaccinate their children, the fact is we vaccinate over 95% of all the children in this country with the series of vaccinations that protect children. The press reports the places that have not vaccinated or have an attitude about vaccination. And the states have increasingly demanded that people get their children vaccinated or they will not be able to go to school. That has helped. So we do mass vaccinations in the United States and around the world for children, UNICEF internationally, and we have a system in place in the United States of early vaccinations for babies and for children. There are pockets of people that put us at risk, and particularly put babies at risk because they don't vaccinate their children, they homeschool them. But that number is pretty small, even though it looks like it's growing in certain communities, Southern California, in the Orthodox community in New York. But basically, the word has gone out and states have not allowed religious exemptions here, and people are getting their children vaccinated. It's the most irresponsible thing I can think of anyone doing, because they're putting every baby at risk, not just theirs, but other people's babies who have not gotten all their vaccinations yet.
The anti-vaccination sentiment isn't just American, obviously. It's global.
No, it's international, and it's based on stupid information, erroneous information. And it's the most irresponsible thing I can think of. We have the vaccine. We've got to protect people. And even flu shots, the healthcare systems in the United States, almost all of them require that their employees get flu shots. But we still have large numbers of people who can get flu shots free that don't go and get flu shots. I think this epidemic will increase the number of people that get their vaccinations, just because of the severity of it and the viciousness of it. And I've been telling people, by the way, to get their flu shots because they don't want to end up in a hospital that has nothing but coronavirus patients with the flu.
Marcia Elser asks, we know about a tiger at the Bronx Zoo who's been diagnosed with COVID-19. What do we know about this human-animal transmission vector?
Hi, Marcia. We don't know a lot, but that was an unusual occurrence. And you can imagine how many people in zoos around the country and around the world are now studying this to try to figure out how the tiger got the disease, how it was transmitted, and whether that tiger can transmit it to other animals. But it was an unusual occurrence, and it's resulted in a desire by zoos around the country to test other animals to see whether this is a pattern. But so far, we don't have a pattern, but there's lots of studying going on to figure this one out.
Another U.S.-centric question here from Ann Simmons-Nicholson, who asks, has there been any discussion about consequences for banks who are requiring opening a deposit account, even though there is already a known person SBA lending account in order to apply for the PPP?
You know, our banks are just scared to death they're going to get investigated, even though we're clearly indemnifying them and we want them to get the loans out. PPE is actually protecting your workers. I think the banks need to get these loans out to small businesses as quickly as possible. And the Treasury has made every effort to urge them to get them out. Now, most of this can be done online so that it doesn't have to be face-to-face. But to the extent that it does, certainly everybody that comes in contact with other people ought to have the protective gear, whatever they need, whether it's a mask or whether it's other kinds of gear to protect themselves. There's no question about that. But, you know, the banks are getting literally billions of dollars to pass out to protect workers and businesses at no cost to them. They're making money from it. And they're being protected by the Treasury in terms of investigations. So I consider it no risk lending. They have to show that they've been prudent, but it doesn't mean that they have to say, no, 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 they shouldn't at all. And I don't know what the deposit stuff is about, but that's ridiculous.
Bernie Coleman asks, international trade, how will this situation impact trade relationships, and how can we expect this to look moving forward, specifically between the U.S. and China and Asia? And Mary Rosa de Coquette adds on, will there be continued isolationism or the resurgence of a more collaborative spirit? Your thoughts? Well,
I hope there's a resurgence of a more collaborative spirit. There is international trade going on. I can tell it by the busyness of the cargo people at the airport in Miami. So there simply is a lot of cargo stuff going back and forth. Not as much as we need at this point in time, but you know, we still have to get the ingredients for our pharmaceuticals in the United States from China and India. And there still is a global market that is barely surviving at this moment, but it's still working. There still is an importation from Mexico of vegetables, for example. So there still are some things going on, but we have to get back to international commerce. Will it result in countries closing their borders, making it more difficult? Not if we get a vaccine, if we get a surveillance system, if we have more safety coverage by the FDA. I mean, we've got to get back to our global markets, but it's going to take some time. It's going to take some time. And we've known for a long time that pandemics will slow down commerce for some period of time. But I'm hopeful.
Rohini Anand writes, I hear from some that those that might have had the BCG vaccine against TB may have some immunity against COVID. If this is accurate, it might be a positive benefit to many in the developing world in Asia and Africa. Do you know anything about this, including the use of the BCG vaccine in the vaccine against COVID that's being worked on?
I know that we've got a bunch of clinical trials out. If you look on the Food and Drug Administration website, they'll have a long list of clinical trials. That's one of the things being tested, but we have no evidence at this moment that would lead you to get that vaccine. And we've got to be extremely careful to keep saying that we don't have a treatment yet, that yes, we're in clinical trials, and yes, we're hopeful about a whole range of things that might work, but we're trying everything.
Are pneumonia shots helpful? I hope so, since I had one this year.
Yeah. Well, let me say about pneumonia shots and flu shots, you ought to get them just to keep out of the hospital where there's so much COVID. I have a friend who's a member of IWF who was just in the hospital with pneumonia. And luckily, they took the fluids out and she got back to her home very quickly. But the last thing you want to do is be in a hospital where there's COVID-19 with something that's preventable. And for seniors in particular, getting the pneumonia shot, for all of us, getting the flu shot is extremely important.
I'd like to wrap this up by asking you a forward-looking question, if that's okay. So you have this tremendous community of people here listening to what you say. By my count at the moment, 821 registered, which is just a phenomenal outpouring of support for IWF and for you, and also interest in the subject. So are there things that each one of us can be doing besides washing our hands and socially isolating ourselves to help our communities and our countries cushion the blow of this pandemic?
Well, in our communities, we have to do everything we can to be supportive of the communities. That includes food banks and other opportunities for people. And there are lots of creative things going on. We've had trouble with people trying to sign up in the United States for unemployment compensation. So the state decided, well, we'll have paper applications. But a lot of the people that need to sign up don't have printers at home, don't have a way of downloading it. So FedEx in our community has stepped up, as have the libraries, and you can pick up an application at our libraries and you can turn it back into the library and they will ship it off to the state capitol so it can be processed. The same thing with FedEx. FedEx will also download it for you, give you the application, you can fill it out, you can give it back to them, and they will FedEx it up to our state capitol so it can be processed. I think anything we can do to come up with imaginative solutions. We also have to write checks. There are lots of not-for-profits that are really hurting in every community around the world. And to the extent we can afford it, we have to start and continue to be supportive of them because they're really struggling, particularly those organizations that are helping poor people, new immigrants in our community. So if you don't have a business that can be helpful, I think it's really important that we give what we can to organizations. But we also have to do it internationally. And I am an internationalist, unabashed internationalist. So I want to do everything I can in Congress, in my country, with our leadership to make the point that this disease knows no boundaries. No one is personally responsible for it, except all of us have to join together. We're in this together. We're going to get out of it together. Thank you, Jeannie.
Thank you so much. One final question for you. Moving forward, are you feeling optimistic?
I'm always optimistic. I just was born optimistic.
And that's a blessing. Congresswoman Donna Shalala, thank you so much for joining me and the IWF membership this morning, evening, afternoon to answer these important questions about a subject that is of principal and primary concern, I think, to virtually everyone around the globe at this moment in time. So thank you so much. And to those of you out there who have been watching and listening, remember there is a recording available or will be on the link to this event and also at the IWF membership portal if you missed portions of it. And we will have future events in the weeks to come. So please keep an eye on your inbox. Thank you all so very much. Stay healthy.